If your X-ray or MRI report says you have a retrolisthesis, you may have been told that your vertebrae slipped backward. It's permanent, and the only thing you can do is manage the pain. Does that sound familiar to you? But here's the part that almost nobody knows. That backward slip is often physically correctable without surgery when you treat the structure, not just the symptoms. In this video, I'm going to show you how we use chiropractic biophysics to realign a backward slipped vertebrae safely, measurably, and without surgery. You'll see how precision X-ray analysis, mirror image traction, and neurological remapping work together to restore spinal stability fast, even in cases that doctors assumed were hopeless. And stick around until the end, because you'll hear Evan's story, a patient who was told surgery was his only option, but avoided it by using the exact corrective methods you're about to discover in this video. Hi, I'm Dr. Jenkins, a corrective care chiropractor in Kelowna, British Columbia. For over 30 years, I've helped people restore their health, mobility, and confidence through advanced, non-surgical spinal rehabilitation. I'm one of only a few doctors in the world who are advanced certified in chiropractic biophysics, and one of just 3 on the entire west coast of Canada. My mission is simple: to help people live strong, active, and pain-free lives for as long as possible. Now, I do that by focusing on real correction, not just pain relief, helping people fix the root cause of spinal problems that have held them back for years. On this channel, you'll find clear, evidence-based videos that explain how your spine and nervous system work, why posture matters, and what you can do to move and feel better naturally. So if you're ready to take control of your health and start moving without fear again, subscribe to the channel. You'll discover practical, evidence-based ways to correct your posture, protect your spine, and keep your body strong for life. I upload a new video every week. Retrolisthesis is often treated as a pain problem, but that's not actually what it is. At its core, it's a structural problem, a vertebrae that is shifted backward relative to the one below it. When that happens, the way forces move through the spine changes, load changes, nerve tension changes, and over time, the spine starts to feel unstable, not just painful. That's why many people describe their back as fragile, even when imaging is called normal or inconclusive. The challenge is that most treatments focus on calming symptoms rather than addressing the position of the vertebrae itself. Adjustments, exercises, injections, and medications can all be helpful for pain, but they don't necessarily change the spinal alignment. So while symptoms may improve temporarily, the underlying mechanics often remain the same. This is also why retrolisthesis is frequently described as permanent, not because it can't change, but because it's rarely measured precisely and rarely treated in the specific direction needed to restore stability. If you don't know exactly how far a vertebrae has shifted, it's impossible to know whether anything is actually improving. And without that measurement, care becomes an educated guesswork rather than a targeted correction. That's why the starting point isn't treatment, it's precision diagnosis. Because once retrolisthesis is measured accurately, the conversation shifts from managing a condition to correcting a structure. Next, I'll show you how we measure retrolisthesis down to the millimeter, and why that step alone explains why so many people feel stuck despite trying everything else. Before you can correct retrolisthesis, you have to measure it accurately. This is where most care breaks down. Many patients are told their x-rays look normal or that the finding is not clinically significant. The problem is not the image. The problem is how it is analyzed. In chiropractic biophysics, we use the Harrison spinal model to evaluate spinal alignment. This allows us to measure retrolisthesis in exact millimeters, not impressions or estimates. We can see how far the vertebrae has shifted backward and how that shift affects the overall curvature of the spine. This matters because structure follows physics. If you do not know the direction or magnitude of the problem, you cannot apply a precise correction. Without measurement, improvement is assumed rather than proven. Accurate measurement also makes care safer. Line drawing analysis ensures that correction stays within normal physiological limits. Nothing is forced, nothing is guessed, and just as important, progress becomes visible. Follow-up x-rays show whether the backward slip is actually reducing or staying the same. When retrolisthesis is measured correctly, treatment stops being trial and error. It becomes targeted and predictable, with a clear direction for correction. This is where chiropractic biophysics and mirror image traction comes in. The correction must match the problem. A backward slip requires a correction applied in the opposite direction. Instead of forceful adjustments, we use controlled extension traction to place the spine into the exact position it needs to move toward. The setup is precise and based on your measurements. The body is supported, relaxed, and guided, not forced. The value most people miss is this: ligaments and spinal tissues adapt to sustained positioning. When the spine is held in the corrective direction for the right amount of time, those tissues slowly remodel. This process is called ligament creep. Yes, that's really what it's called. And it's a predictable mechanical response, not a guess. That's why this correction can be passive. Patients are not twisting or straining. Much of the work happens while they are simply lying in proper traction. Research from the Chiropractic BioPhysics nonprofit organization has shown that this type of extension traction can reduce retrolisthesis non-surgically. The goal is not temporary relief. The goal is to change the resting position of the vertebrae. Once the structure begins to change, the next challenge is keeping it there, because if the brain does not recognize the new position as normal, the spine will drift back. That's why the next step is neurological remapping. Changing spinal position is only part of the solution. The brain also has to accept that new position as normal. Your nerve system maintains a map of where each joint should sit in space. If that map is outdated, the body will unconsciously pull the spine back into its old pattern, even after structural correction. This is why some changes do not hold. Using sensory motor integration techniques based on Dr. Heidi Havoc's work, we retrain how the brain perceives spinal position. This helps the nervous system stabilize the correction instead of resisting it. The value here is simple. Structure tells the brain what is possible, and the brain tells the body what is safe. When both are aligned, stability improves faster and lasts longer. One of the biggest concerns people have with retrolisthesis is safety, especially when surgery has already been mentioned. This approach is designed to be non-invasive and controlled from the start. Every traction setup is based on measured alignment. Forces are gradually supported and patient-guided. Nothing is forced past physiological limits. Safety comes from precision. Line drawing analysis and repeat imaging ensure that correction stays within normal ranges and progresses appropriately. It's also often faster than symptom-based care, not because anything is rushed, but because the mechanical cause is finally addressed. Patients stop cycling through treatments that only calm pain without changing structure. When structure improves, stability often follows quickly. And when stability improves, fear of movement tends to fade. This is exactly what my patient Evan experienced. Evan came in after being told surgery was his best option. He had significant retrolisthesis in his cervical spine that was compressing his spinal cord. This was confirmed not only on X-ray, but MRI. The concern was not just pain, it was a long-term neurological risk. So rather than guessing, we started with precise measurement. His imaging showed a clear backward slip that explained both his symptoms and the instability he felt. Our care focused on mirror image strategies specific to his measurements. Chiropractic BioPhysics extension-based traction was used to oppose the backward displacement combined with neurological remapping to help his nervous system adapt to the new alignment. Over time, follow-up imaging showed measurable improvement. The backward slip was reduced, spinal alignment stabilized. His symptoms improved alongside those changes. We don't always have this, but the most telling moment came from his medical doctor. After reviewing the follow-up MRI, the response was simple. He had never seen a retrolisthesis stabilize like that before. So this outcome was not luck. It was the predictable result of correcting the physics of the spine and reinforcing that correction neurologically. Evan avoided surgery. More importantly, he regained confidence in his neck and his future. So if you've been told you have retrolisthesis, it does not automatically mean surgery or lifelong fragility, but it does mean structure matters. When a backward slip is measured precisely, corrected in the right direction, and reinforced neurologically, stability can improve. Not just how you feel, but how your spine actually functions. The goal is to not chase pain relief. The goal is to restore trust in your spine so you can move, lift, and live without constantly protecting your back. This approach is not about force or quick fixing. It's about applying physics, precise measurement, and neuroscience in the correct order. That is how symptom management turns into structural change. And that is how people stop managing a bad back and start trusting a stable one. So if you're looking for this type of care, make sure you work with a Chiropractic BioPhysics trained and certified doctor. If you need help finding one, drop a comment below and I'll share the link to the online doctor directory. If this video helped you better understand what is possible with retrolisthesis, take a moment to like and share. It helps more people find accurate, evidence-based information. And if you want to learn how posture, spinal alignment, and targeted traction can protect your spine and keep you moving with confidence, subscribe to the channel. I share practical, research-driven strategies you can use to support your spine for life. Now, some people can have both retrolithesis and anteriorlithesis, a forward slip vertebrae, at the same time. If you want to see the specialized traction table we use to correct anteriorlithesis, watch the next video.